Good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, back with you, broadcasting live from the Dolph Simons Family Studio. It's a delight to be back with you again on this wonderful Wednesday. I am joined, of course, by Hawkeye, faithful ally here in the fight against COVID and all things that related to cows.
Yes.
We'll talk more about cows in a little bit. We're also delighted to be joined by Selena Geer. Selena is an outstanding allergy and immunology physician here at the University of Kansas Health System. She trained here.
Yes.
We're delighted to have her back. She's my doctor. I think she's the doctor for half the people here, and so we are so happy you're here with us in the studio. We're going to talk a little bit about allergy and COVID. We also have in Studio B for bow ties, Dr. Keith Sale. Keith Sale is one of our outstanding ENT physicians. He's also the vice president of ambulatory for all of our ambulatory practices. Keith has had a patient who may have surprised him. We'll talk about that in a moment when we turn back to him. Just remember, Keith Sale, B for bow ties. He's in Studio B for the B guys.
Right.
Hawkeye.
Yes.
How are we doing?
Well, we're doing pretty good. I would like to say that, it's always appreciative when
I know the redheads on the show, blah, 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 blah.
Selena, late at night or on the weekends after I've seen some of her tough patients, and she's always available, so that's really nice. So. Always available for her patients. As far as in the hospital, we are doing really good. A lot better than we were a couple weeks ago, a lot better than earlier in the week.
Couple of 36 for a while.
Yeah, down to 23. So 7 of those 23 patients are in the ICU, 4 of those are on the ventilator. And again, there are 30 who are in COVID recovery status. But as far as active infections that we are addressing and treating appropriately, 23 patients. So.
Yeah, so it's better. We've been cycling between 20 and 40 here for the last few months, and goes up and comes down with a lot of just kind of variation within that. So COVID is still out there. It's still true. Yeah. Still pretty nervous about schools reopening and what that's going to mean, because we know that a lot of schools have delayed their opening until after Labor Day. Mm-hmm. So we won't see that impact for a while. And the University of Kansas opened really about a week and a half ago. We won't see that full effect on Lawrence and wherever it's gone for another week to two.
And we should note that as far as the numbers in the Kansas City community, the 7-day rolling average is higher than it was a week ago and 2 weeks ago. So that is so. Again, as we talked about before, there will be fluctuations. We want the overall trend to decrease, but I think moving forward now, especially with the schools restarting, and as summer starts to end and maybe people are going inside for colder weather, we are going to probably see fluctuations in that number.
Yeah. So Dr. Geer, and just to say, I've often said Geyer instead of Geer, and I'll probably get it wrong during the program today. So if you hear me refer to a Dr. Geyer and a Dr. Geer, it's really the same person, just so you know. So allergies, COVID, how the heck to tell the difference?
Yeah, this is really tough. And right now we've reached kind of our peak fall allergy season.
Yeah.
Also, we're starting to see kids go back to school. Kids are re-entering daycare. So you really have a mix of symptoms that are very difficult to tell apart.
Right.
So it becomes a challenge.
It does become a challenge.
Always a challenge when we go back to school, when kids start to get any viral infection on top of having seasonal allergies, trying to pick apart what's an illness and what is an allergy symptom. So I have a nice infographic that is put out by the CDC.
Awesome. Let's take a look at that.
That helps patients determine what some of their symptoms are from. I'd like to highlight, starting with allergies, that itching, particularly nasal itching or eye itching, is going to be one of those symptoms that is most related to allergy symptoms. Sneezing, also most related to allergy symptoms. There's sort of a gray zone, sort of an overlap zone, where you might have symptoms off, maybe even change in your sense of smell, which happens for some patients with allergies. Certainly congestion, maybe even sore throat from drainage in the back of your throat that many allergy sufferers get. But ultimately, if you're having fever, if your symptoms are not typical for your allergy symptoms, perhaps this is not a typical allergy season for you, and you're having cough, and you're having congestion, and you're having change in your sense of smell, it's time for you to be thinking about contacting your doctor to get tested for coronavirus.
All right, so those are big, important things. What else can you tell us about that?
So one thing that's very important is to maintain control of your allergy symptoms and to avoid any contact with people who are sick. So maintaining your medications for your allergies to make sure those symptoms are well controlled is very important. Also, knowing what your triggers are is also very important. If you know that you're going to be doing yard work and the next day you feel itchy and drippy and sneezy, you can probably attribute that to your allergy symptoms and not an acute onset of coronavirus symptoms. Also, I'd like to highlight our asthmatics. One big question I'm getting right now is, if I have asthma, am I at increased risk for complications from coronavirus? And the answer is probably. We, of course, still have so much to learn about asthma and how that plays a role in long-term complications from coronavirus. But as you can see in this infographic, it's on the lower end of the spectrum of complications. It is still there. It can put you at increased risk for complications and hospitalizations from coronavirus, but is much less common to cause complications when compared to obesity and hypertension, as you can see in the bubbles that go to the right, increasing your risk. So asthma is still there, but of course, like always, we're still learning a lot about how asthma can play a role in an infection such as coronavirus. I will tell you, one of the biggest triggers of asthma is a viral infection. So like always, even influenza, we want people to be washing their hands, social distancing, cleaning their areas, and staying away from people who are sick. With regard to asthma management, it is also very important to keep your asthma under excellent control. This is particularly important during viral illness season. We want patients to stay on their medications, take them consistently, make sure that you have a 30-day supply of your medications, and also to avoid other things that might trigger your asthma, particularly in this season, the allergies. We know that allergies are a big trigger for asthmatics. One other point I'd like to make is cleaning chemicals. So many patients' asthma can be triggered by chemicals or irritants. If you're triggered by those, you may ask somebody else in your home or your work environment to help with some of the disinfecting they're doing on a regular basis to help to alleviate some of those triggers for your asthma.
Yeah, great advice, and I'm impressed you could say all that off memory. I would have stumbled a few times on that, so well done.
May have been asked about these things a few times in clinic.
You may have.
Like maybe 10 times a day.
There you go. Well, I think it's great advice. And so, Dr. Sale, I know that you treat allergy symptoms as well in your clinic and ear, nose, and throat because you specialize in sort of that kind of sinus and allergy disease. Talk to us a little bit. And I understand that one time you had a patient who was supposed to be being treated for allergies and may have surprised you with a different diagnosis.
Yeah, so we see in ear, nose, and throat, we see a lot of sinonasal disorders, including allergy. And so I share several patients with Dr. Gear, and allergy is a big part of our practice. And so in particular, we had a patient who had come in and was complaining of runny nose and just allergy symptoms that weren't getting better with her traditional methods. So she was on her normal medications. She always has symptoms this time of year, but thought maybe she had a sinus infection or something else. And so as we walked through her symptoms, it became clear she'd actually had her friend come stay with her the week before that from out of town. And so there may have been a possibility of some outside contact outside of her family bubble. So we talked about getting tested. And so she decided to go ahead and get tested and was unfortunately surprised with the positive COVID response.
So hopefully she's done well. And you and your office have been safe, though, because you guys wear lots of PPE, I think.
Yeah, we use the universal precautions across all of our ambulatory settings where it's face masks, eye protection, it's frequent hand sanitization in and out of every room. All of our patients wear masks except for when they're being physically examined in the nose or mouth. And so I think ultimately our team is very safe. Our patients are very safe. And so I think this was a great instance of talking through with the patient their symptoms, keeping in mind there could be more to the picture than just seasonal allergies, and given the setting and the background, making sure we look towards testing in the right situations.
Yeah, always important. All right, well, Jill, let's first turn to media and see what questions they may have today. All right, not hearing any, then we'll turn to our listening audience and viewing audience and see what's out there. I suspect there's a few.
There are, coming in both over Facebook and the Medical News Network. Doug wants to know, do my allergy meds and rescue inhaler help with COVID-19 symptoms?
Ooh, that's a great question. All right.
So the answer is probably not. Allergy medications are meant to trigger the chemicals released during an allergic reaction, which are probably not a big part of the immune response to coronavirus, so they're probably not going to be that helpful. Of course, if you have an asthma flare associated with the coronavirus infection, you want to talk to your doctor, make sure that you're using your inhalers, including your rescue inhaler, properly, and that may help with some of the pulmonary or lung inflammation that happens during a viral infection with asthma.
You know, just say that the albuterol, if you're getting short of breath, it often makes patients feel a little better, or they think they feel a little better when they're short of breath. The problem is that it can also be a bit of an upper because it can give you a little tachycardia. Sometimes it makes you just feel better, but the reality is you're probably not actually helping your lung from that. I don't think there's been a lot of proof that albuterol helps in a COVID exacerbation.
Yeah, the only thing albuterol is doing is opening your airway. It's not getting rid of any of the inflammation that a viral infection might typically generate in a patient's lungs during an asthma flare. So albuterol can be helpful. It's helpful for a short time. We'd recommend you use it if you're short of breath, if you're coughing, if you're wheezing, in any asthmatic patient. But be careful if you're using it more than the recommended dosing, then your doctor needs to know so that they can maybe see you in their office and maybe adjust some of your medications.
Hawk, you've been seeing patients with COVID. What's your sense about this whole thing about allergy versus COVID?
Yeah, I totally agree. I think you came with a good point, Selena. The itching, you have the itching with the allergies, and although touching surfaces and touching your eyes, your nose, your mouth to get COVID is probably less likely now, especially with everybody masking and that barrier protection. But that is exactly one way that can lead to that. If you are having the itching and you're itching your nose or your eyes and you've touched surfaces that recently somebody who has been ill has come by and done that. As far as the other issue about the COVID and the allergies, the treatments, yes, are going to be completely different. I agree with you. It probably will not help. Although some of the symptoms may be similar, the mechanisms of that are different. Same with a viral cough and cold. So especially, fever was going to be an important thing, like you said, although we are learning now maybe not as many people have fever, 50 to 70%, depending on what demographic you're looking at. But it's certainly a different type of mechanism. Even though some of these symptoms may be similar, because symptoms are general and not really pathognomonic for one disease, the way that they get to that symptoms, the mechanisms causing those symptoms are going to be different. So.
Right. And of course, if your allergy symptoms are worse, if you're making more mucus, it might predispose you to things like sinus infections and kind of more of stuffiness. You just want to make sure that your allergy medications that you're taking them properly at the direction of your doctor.
All right,
Okay.
Jill.
Yeah, Lee has read an article, and it was about a supercomputer analyzation of C19. And she said in it, they came out with a new hypothesis of bradykinin storm that may lead to new possible treatment options. She wants to know what all you doctors think about that.
Bradykinin is what I think that word really is. And so I know you're the immunologist. We'll start with you, Selena. Just to say, we've been using a lot of supercomputers to analyze COVID-19, but I've not heard bradykinin yet.
Yeah, bradykinin is a chemical our body releases, mostly generates swelling. Generates swelling in patients who have some genetic defect, or if patients are on certain medications for blood pressure. And that is probably the most important process of bradykinin. Causes blood vessel leakage, so you get swelling. I'm not sure that I could implicate this much in the inflammatory response. It's not necessarily as much of an inflammatory chemical as it is kind of a leakage chemical, so I'm not sure I could. I'd like to read more about that, but I'm not sure I could say that would be kind of an end-all, be-all cause for the inflammation that's going on in the reaction patients are having due to coronavirus. There are treatments for bradykinin. They are only used in patients who have a genetic defect that releases too much bradykinin. Those patients present with swelling episodes, and it's a hereditary genetic process. They're available. They are very costly, and I'm not sure that I could justify their use in patients not knowing more about how bradykinin really could contribute to the inflammation.
Dana, thoughts?
Yeah, I agree. I think the good thing about this is the world is going rampant. There are a lot of resources towards looking towards treatment and vaccination against COVID, things to help people who do become infected. But getting those high throughput and those computer simulations down to actual in a patient is very difficult to do. I think it's good that we are pursuing those things, but right now the things that we have had as far as looking at different molecules from the immune system, cytokines, which everybody is aware of, so far a lot of those studies have not shown any signal or any significant change or positive treatment in treating patients with COVID-19. But it's good to continue to investigate.
Yeah.
Yeah, I think I'm with you there. Think about all the possibilities, but beware of anybody who tells you they've got the final answer.
Correct.
Because you know what? There's no final answers yet, Keith Sale.
Yeah,
Go ahead.
Steve, what I would add is that I think our physicians and our teams need to have a higher degree of vigilance sometimes around this, because sometimes it's not the classic allergy symptoms as we saw. It's the more subtle ones like fatigue or headache that sometimes will trip up our patients. And although those may be part of their allergy picture, it's the persistence of those symptoms for an extended period of time beyond their normal medication management that sometimes should have us think about getting those patients tested and trying to make sure that they're not becoming a source of spread for that virus amongst their family and friends.
Yeah, and I love what he said, that the allergy medications are not working. That should trigger you to think that maybe there's something else going on.
Well, I think you said earlier, and this is really important, in this time of COVID, it is so important to take your medications. It always is, but I think even more so now, so you can tell if that where you're veering off course. Are you veering off course because you're not taking your meds and the allergies have come on, or your heart failure has gotten worse, or whatever? And or is it because you've got a new disease that's different and it's COVID, and then you need to go get that evaluated? So I think that's a really important point. Appreciate you making it.
Mike says, I've recently been told by my allergist that my symptoms are actually reflux issues. What are you seeing with this in other adults? Can you confuse that with COVID-19?
So I would say that reflux can be a big component to uncontrolled sinus issues and uncontrolled asthma. It's something that's sometimes overlooked because not all patients have that typical burning chest pain that they have with reflux or heartburn. Certainly, if patients are having these symptoms on a consistent basis, it would be worthwhile for them to try a medication to help reduce that reflux. Again, if that's not helping, you need to be thinking that maybe other testing may be helpful. I think reflux can cause those symptoms, but it probably wouldn't be something that happens, one day, like when you fall ill with a viral illness, where symptoms are definitely different that day than a few days ago. Obviously, again, important to treat that if that's an underlying issue. Dr. Sale may have some other comments about that because he sees this pretty commonly.
Dr. Sale.
Yeah, I would add, reflux, one of the most common symptoms that crosses over between reflux and allergy is that sensation of postnasal drainage. What most patients feel as postnasal drainage can be either coming from the nose, most commonly for allergy sufferers, but a lot of times is actually the hyperacidic irritation in the back of the throat that also can trigger that same sensation. So differentiating between allergy and reflux can be a challenge because it's both perceived as postnasal drainage in terms of it as a symptom. And so I think your allergist may be right in that if they've tried everything to manage their allergies and it's not working, but you still have that kind of frequent throat clearing and lump in the throat sensation, it could be from hyperacidic irritation caused by reflux.
Yeah, I will just say as a reflux sufferer, very true. Watch how much caffeine you drink. It's everywhere, and it causes a lot of reflux. Instead, we like to drink a lot of coffee. And I know a lot of people tolerate it just fine, but for those of you who don't, reflux is real. Lung disease related to reflux is very real.
Yes.
Christy says, I have rheumatoid arthritis and I take biologics. I have read that these can help with COVID. Is that accurate?
Oh, man. Can biologics help the course of COVID or worsen the course of COVID?
So I think that the jury is still out on this as we continue to learn. Initially, there were a lot of concerns about patients being on their immunosuppressants for autoimmune diseases like lupus, rheumatoid arthritis, psoriatic arthritis, and I think those recommendations have really mellowed out as we understand that it's not something that puts patients at serious risk for complications from coronavirus. I think there's still a lot to be determined whether or not these medications have been helpful in reducing complications. We certainly know that patients on these medications have been known to have complications, and we certainly know that some patients do very well on them when infected with coronavirus. So I think this is where those evidence-based studies are very important for us to work through, trying to see in a systematic fashion how patients do. I know there's registries for this that patients can enroll in, and I know there's ongoing studies with regard to medications used in autoimmune disease to maybe think about using those. Unfortunately, a couple of those medications have fallen short of showing improvement, like hydroxychloroquine and tocilizumab, which are common immune suppressants for autoimmune disease. But again, we just keep working, trying to find new solutions and new information as time goes on.
Okay, Donna says both mold and ragweed pollen counts have been high lately. Products like Zyrtec say to take them only 1 time per day. Is it terrible if I take them 2 times a day if it triggers?
So we do, as allergists, we do often push the doses of antihistamines very safely in patients. So we do commonly recommend patients take Zyrtec or medications like that more than once a day. We prefer the non-sedating medications, so Zyrtec, Claritin, Allegra, Xyzal are our most common ones people will use, to use those more than once a day with safety. Also, if you're not getting by with those kind of medications, it may be time to talk to your doctor about adding a nose spray, eye drops, and there are other medications we can employ to help control your allergy symptoms if they're not well controlled.
Dr. Sale, you mentioned a few minutes ago that it was safe to come and see you as a physician, and I bet some people are still concerned because they have all these questions and they're all related to allergies. Some of them are just kind of baseline questions about how do I take care of allergies. So talk to us a little bit. What is KU doing to make sure patients stay safe?
Well, Steve, it started at the very beginning of the pandemic with really trying to recognize that we want to move our patients through our spaces with minimal contact. And so we have a direct rooming process that begins with when you arrive, you go straight to a room. So we're really trying to keep our waiting rooms empty to avoid kind of close contact with other patients. We also want less contact with our teams where it's less necessary. So the check-in desk, we try and bypass that and go do a lot of our rooming processes in the rooms now with the patients. And then all of our staff wear the highest levels of PPE to protect themselves and to protect our patients. And we ask that all of our patients and their guests remain masked as well to help limit that spread of potentially infectious droplets. And then obviously the usual hand sanitizer in every room, outside of every room, using it every time we walk in and out of the rooms is critically important to maintain that sanitization. And so we spend a lot of time with our teams trying to make sure that we have the right PPE on and that our patients have the right level of masking to take care of everybody, and then move patients through in a process that limits their contact with everybody.
So just another thing I want you to hit on. So every morning I read the New York Times, Washington Post, the Wall Street Journal, Stat News, the New England Journal, Annals of Internal Medicine, the Kansas City Star. And I look for all the stuff that's out there about COVID and trying to make sure I'm kind of current and been able to try and see what's going on. And so in the Stat News, which is a product of the Boston Globe, and it contains a lot of medical information in it every day, look at that, and they're saying telemedicine visits are plummeting. But really, telemedicine visits are up a ton from where they were. As people reopened, we've kind of hit a new steady state. Talk to us about what the future of telemedicine is and how it's going to relate to our patient populations and treating people with COVID.
Steve, telemedicine was a transitional tool for us. And so it allowed us to replace a lot of those face-to-face visits early on in the pandemic when we were still trying to figure out the PPE and the clinic flow process. Since that time, we've figured that piece out, and now it's back to face-to-face visits for the majority of our patients. But we still have a lot of patients who benefit from telehealth, whether it's because they have comorbid conditions or because they are fearful of coming to the hospital or because they live too far away and the drive is an onerous thing. So we still see roughly 800 to 1,000 patients a day via telehealth. So at our peak, we were probably between 1,500 and 2,000 telehealth visits a day. As we've reintegrated face-to-face visits, that has shifted a little bit. And so at our height, we were about 50-50 face-to-face and telehealth. And then now we're probably about 70, or probably about 80-20 right now, face-to-face telehealth. But I think telehealth is here to stay. I think it offers a great way for us to reach patients with complex conditions who may struggle to travel long distances to come to see specialists. And so it's a great way to begin that patient relationship or to carry on a chronic condition management through a telehealth where you can see patients in their own environment and prevent them from having to travel long distances.
Yeah, I had my clinic yesterday, and it was a telehealth clinic, and I love telehealth, actually. It's so, I mean, there are things you can't do. You know, lack of a physical exam is bad, so I make sure I stagger. If you come to see me one time telehealth, next time you're probably going to be in person. I want to listen to you. But you know, the truth is that in some ways, it is so amazing to do telehealth because I think it's a more focused visit. You don't have quite so much noise around you, and you get to see patients in their home, which I really like.
For an allergy,
that's the best.
For an allergist, it's really nice to see what their home environment is like. I've been really surprised. And
oh wait, you didn't mention you have 37 parrots in the house. Huh?
I know, to see what home environments actually look like, and that has really been enlightening and may change my course of treatment for those patients. And also, you know, they've got their medicines there. They can show me exactly what they're using, how they're using it, which cream they're using. They can actually show it to me because patients
you can't.
don't
I'm not doing a
typically
telehealth visit with you, man. I'm gonna fail. Which creams are you using? I don't know.
But it has been really, really helpful for a lot of my patients. I had a mom with 4 children drive 5 hours from Garden City to see me in clinic the other day, and I told her, I said, why didn't we do this via telehealth? She's like, that would be amazing, you know.
Yeah,
4 children.
4 children in 5 hours. Be like, oh yeah, the psychiatrist is right over there.
That's right. So it really has offered us the ability to reach out to those patients who, for whatever reason, can't travel. It's so far to travel. It's very cumbersome. And also my immune deficiency patient population has really enjoyed being able to do telehealth. Even though we're taking such extreme precautions when they do come, they're always very complimentary of the way that patients are being roomed and the safety of how they feel when they're here, but they really do enjoy being able to stay at home for their visits if I don't need to actually see them.
It's terrific, and I know you've been doing telemedicine too.
Yeah, but I agree with you, staggering the visits because the physical exam is so important.
Absolutely.
So especially for my HIV patients, or if I have patients who are on IV antibiotics for one reason or another for 4 or 6 weeks, the telehealth does make it much easier. You can get a lot of information, but there are those times you do need the physical exam as well.
Right.
Yeah. All right, Jill.
Craig wants to know if a person who had symptoms when they had COVID, will they have symptoms if they catch it a second time?
Oh, that's a great question, Dana, and I think we don't know the answer to that entirely. We remember the gentleman from Hong Kong who didn't have symptoms. He was found on a routine screening when he came back into the country, yet the person in Nevada felt worse. So I just don't think we know yet.
Yeah, I think that the amount of data is so little right now as far as documented reinfection that we just don't understand that. That is hopefully one of the questions we'll get the answer to in the next 3 to 6 months or so. But it is important because we have to understand how to document reinfection. It's not just with symptoms, but in these studies that they're looking at, they actually went and sequenced the virus and found that they were off by 2 base pairs, 6 base pairs, something of that nature. So the virus was genetically different. Now that doesn't mean that there's necessarily other strains. Right now there is no other clinically significant different strain. There is only one strain. But when they look at it on the genomic level and look at the base pairs, they have found a difference in the base pairs. So.
Yeah, so what do you think is going to happen with all this?
The other day you mentioned that not everybody has the same immune response to a viral infection. And I want to make sure that patients understand that while most people are going to do very well with a viral infection as far as generating immunity, this is a new virus. We're not sure how that immunity is going to be generated. We're not sure how long it's going to last. We're learning about this. But there will always be a few patients who just don't have a stellar immune response to any viral infection. And perhaps that gentleman in Nevada may have had an underlying immune abnormality that could have predisposed him to a poor response immunologically.
And we know these people don't mount antibodies, and others do mount antibodies to other types of infections. And so it may not be a surprise that somebody doesn't mount an antibody. We have ascribed to SARS-CoV-2 all these unique superpowers, but the reality is it's just a virus. It's a bad virus, but it's a virus. And so all the things we know about our response to viral illnesses still apply to this virus.
And not everybody is going to make a perfect immune response. Perfect example of this before the chickenpox vaccine is some people would get chickenpox twice.
Why? Because they do. They don't
either
have a
had a mild case or didn't generate a normal immune response. That's not a point at this time because we have a chickenpox vaccine that does a great job inducing a robust immune response, and we hopefully will be there with a a SARS-CoV-2 vaccine at some point.
It's the wonder of human biology.
It is the wonder. You know, some people respond to influenza and get really, really sick. Some people do really well, and some of us get it for our 60th birthday. What a gift.
All right, so Laura wants to know, on that note, with flu and cold season coming up, is there a concern for an abundance of testing, and how do you tell flu from COVID?
All right. Well, what do you think? I think we've got a lot of testing going.
Yes, great question. We are currently working on our influenza COVID testing algorithms right now for both inpatient and outpatient. We think a lot of these platforms that we have traditionally been using for influenza and other respiratory viruses are going to add the SARS-CoV-2 test onto their platform, onto their tests, so that will make it a little bit easier. Of course,
so if you get a rapid flu in somebody's office, that's going to be a rapid flu. But if you get a swab, we can do a swab, and that same swab can be used for both influenza and SARS-CoV-2.
And RSV.
And RSV. And actually could even be used for a full viral panel if we have to.
Yep, absolutely. And I think you brought up a great point about the rapid antigen testing. As of right now, we really don't have that. But moving forward, Dr. Leisman, Dr. Plapp continue to evaluate all of the products out there. So we are working on that algorithm on how best to test. We hope, based on especially South Africa and Australia, that the influenza season will be pretty light here because it is there right now, which they have been very lucky, but that's probably because of the masking, the distancing,
makes all the
hand
difference.
hygiene. So, but we are preparing, number one, for mass influenza vaccination, but also our testing algorithm, we are working on that as well.
And to attest to that, please, get your influenza vaccine. We typically recommend people start vaccinating in October, and make sure that you stay up to date on all your vaccines, for that matter, to help protect you through the season.
All right.
Becca has a son whose preschool has kids ages 3 to 5. The staff all are required to wear masks, but the children are not. She's worried about her son. What should she do to keep him healthy, or should she just keep him home?
Oh man, this is another one of those bubble questions. And how big is your bubble, and how healthy is your bubble? And because there's no right answer to this question. The answer to the question is really very relative. If there's other people in your home that are sick and you're afraid of the kids spreading the disease inside a daycare, or a child care situation or a school, it's very true. It is likely to spread, especially if the kids aren't wearing masks. So then you just have to ask, how healthy are the people at home, and whether you're willing to take that as a chance. So let's go around the horn and see what everybody would do.
Yeah, there was a pretty good article. I can't remember. It was a CDC publication. Can't remember if it was MMWR or Emerging Infectious Disease, that looked at a bunch of daycares in Georgia. And in those instances where they did have the adults doing the proper public health guidance, masking, distancing as much as possible, hand hygiene, they did see a low rate of spread throughout those and to the other households. But again, I think it's important to know, as Dr. Geer had said, there is just a paucity of data about this. We are still asking these questions. We are still looking for the best answer. So I think moving forward, take that for what it's worth. And as Dr. Stites said, understand who's in your household and who is further at risk for more severe disease, and make the decisions based on that.
And many daycare centers and schools are going through extreme measures to sanitize when the kids are out playing outside, in between classrooms. And many are keeping their kids in single classrooms so that those children are not interacting with other children in the school situation, to reduce the number of interactions and potentially reduce spread. So I would encourage people to ask about their daycare situation or their school situation to make sure that all those actions are in place. And I'm sure they are. We've read a lot of things about, even in my own children's school, about how they're doing the sanitization on a very frequent basis, and making sure that's being done.
Keith.
Yeah, I would echo the statements that have already been made. I think this is a very personal decision, and everybody's situation is unique. I think you can be as most informed as possible by talking to your daycare about what they're doing to prevent the potential spread of COVID. And if you're comfortable with that and comfortable with your home situation, I think allowing your kids to go to daycare is certainly reasonable. However, if you have concerns about the way your daycare is managing it, or about your home situation, then certainly keeping them home is also an acceptable alternative.
Yeah, and one thing is, I don't think you should be shamed either way. There's a little bit of a shame culture out there. You're wearing a mask, shame. You're not wearing a mask, shame. You put your kids in daycare, shame. You don't put your kids, shame. I think the truth is, it's a highly personal decision. Stay away from the shame game, and instead try to make the right decision for you and your family. If you're at risk for outcomes around COVID-19, kids probably need to stay home. if you think things are really healthy and you're willing to accept the risk because they will probably bring it home, then okay, send your kids, because or maybe your kids need to be at school, or maybe you need to work and you need your kids to go to school. Those are all real world things, and you know what? That's okay, and those are the decisions you have to make.
Elena has a follow-up for Dr. Geer. If I had chickenpox twice, would I potentially be a person who wouldn't mount enough or antibodies, or is it different for every virus?
Yeah, that's a great question.
Yeah.
You wouldn't necessarily know. So in the example for chickenpox, you can actually check your antibody levels to see if they're still protective against that virus. Antibody levels against viruses can be done. They're not done routinely unless we have concerns about that patient's immune system. And we probably are not going to be doing that on a large scale with SARS-CoV-2 unless you're enrolled in one of the vaccine trials.
Then that's a different question.
If you're enrolled in a vaccine trial, I'm sure they will be monitoring antibody levels to see if you've responded. We don't typically do that with influenza. So my guess is if your immune system is normal, you don't have a history of recurrent other infections, you will have potentially a very normal response to the COVID-19 vaccine when it becomes available.
And because and Dan, help me with this, but just because you've not responded to one type of infection doesn't mean you won't respond to a different type of infection.
Correct.
Yeah, absolutely. And Selena could talk about this even more. But yeah, absolutely. And again, we said it's the wonders of human biology. So certainly one type of viral infection you could react different way, or your immune system to react differently. Maybe not the same as the general population, but differently. But yet to the next infection, you could just act as more of the general population, have the regular manifestations. So.
All right. One more question.
Oh, no. We have oh, shoot.
One more.
Okay, so I guess I'll go with this one. And just know, Doctor, that you guys got really great questions. We'll try to put some on tomorrow. Susan wants to know what all the doctors think that they should do to boost our immune system daily.
Okay, what do you do, Selena?
That's a great question. I think getting a lot of sleep, getting an adequate amount of sleep is very important. Making sure that you're eating a healthy diet. So patients who eat healthier have enough vitamin C, have enough zinc in their natural diet. That's very important.
Don't forget bacon and potato chips.
And maybe some bacon and potato chips here and there. But if you're getting a natural amount of those vitamins in your foods, that's a better source than taking a pill source. And then just making sure that, again, you're hand washing, you're staying away from sick people, not putting yourself at risk based on the people you're around for those types of infections. And again, this goes for influenza, this goes for RSV, this goes for COVID-19.
All right. Keith, final thoughts today.
Yeah, I think Selena made great points. I would add the other piece of this is mental health. It is making sure you are doing the things to connect to other people and to try and connect, whether it's to family or to friends, to do the things that keep you mentally connected, because I think that can have a big impact on your physical health. And so I think making sure you take care of both your physical health and your mental health is probably the best way to try and combat this virus.
Yeah, I can't say it better than our two guests. You know, with so many stressors in life today, whether it's social media, whether it's your workforce, maybe you're working in a school and that's very stressful there. Just a healthy lifestyle, and that it's a simple thing, but it is very difficult. So it is exercise, whether that's walking or running or lifting weights, getting a natural fortified diet. So for the most part, diets in America, if you're getting things, a lot of our foods are fortified. You don't need to really supplement with other vitamins, but getting a healthy diet, getting sleep and rest. And if you can, have other socializations, whether it's over Zoom or it's physical distancing, but all that will help with your physical and emotional health and thereby help your immune system in a natural way. I don't believe there's really any significant immune boosters as we see advertisements for. If you're doing the healthy diet, the exercise, and the mental and emotional health things that you can do, that is going to be the best for you.
Absolutely.
All right. So let's talk a little bit about what's coming on for tomorrow. First, I want to thank our guests today. It's been outstanding. I think we need these folks back.
Yeah,
There's a lot of questions here, Jill. We'll have to try and get them back with us again really soon. There's a startup called CV Key, co-founded by a KU alum and former Google vice president by the name of Brian McClendon. He's helping to keep students and faculty safe on the campus at KU. Brian is joined by co-founder of CV Key, Marcy Nielsen, to explain how the apps they are creating could be used to help keep the public safe. Chris Wilson, VP of System Integration and Innovation, will also be joining that conversation. I think it'll be a really great conversation because these are some pretty bright folks. We've had the opportunity to work with them, and it's really kind of about contact tracing and how to know if you've come in contact with someone else. So they got a pretty unique tool that looks really good. Hey, don't forget this, send us your mask photos. Now, there's a really goofy guy in this mask photo who's got ears large enough. It reminds me of the Dumbo cartoon, I can fly, I can fly, I can fly. But, yeah, let's not talk about that anymore. But it is an example of wanting to get back to the K, and yes, wearing a mask all at the same time. So thanks for that to our team who helped take that photo and get that in there. It is shown at the Royals games.
Yeah.
My wife looked at the game last night. Oh, there you are. I'm like, yeah, we don't talk about that. That's just better. Hey, you know, great topics today, and thanks so much again to all of our guests. Allergies and COVID can be confusing. All the COVID stuff can be confusing. We continue to try to build the airplane while we fly it. Always a challenge, and we're also learning how to fly it at the same time we're building it and we're in the air. It's a little bit tricky some days. It's tricky for you as part of our listening audience to try and sort through all the information out and everything you hear. Here's what I can tell you about this program. We're not political. We're not flapjacking. We're not going to wave our arms and just jack with you and tell you stuff. We're going to tell you what we know to be true because we just want you to stay safe. We want you to be KC and help us get this ball across the finish line. You know, the Chiefs start their season a week from this Thursday against the Houston Texans over at Chiefs Stadium. They're going to run it back. We want to be with them the whole way. We want to see that next Super Bowl, and the best thing we could do is keep each other safe. Wear a mask, wash your hands, keep your distance, cough at your elbow, stay home if you're sick, and most of all, show your love by taking care of the people you love. And remember, till tomorrow and every other day, there's still no place like home. We'll be back tomorrow.